You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering an epidural steroid injection. With us, we have an expert on the topic. He is an interventional pain management specialist, board-certified anesthesiologist, Dr. Dobecki. Dr. Dobecki, welcome to the program.
Thank you for being here.
Great. Now, for people that don't know you, tell us a little bit about your practice, because I guess you do a lot of things more than just the steroid injections.
Yeah, so we do chronic medication management. We do interventional pain therapies, neurostimulation, injection therapies, facilitate rehabilitation services, physical therapy, etc.
Okay, good. So, epidural steroid injections. Some people, I guess there's some dangers associated with this.
Yes.
So what do people need to know? Because it was one of the topics you wanted to talk about.
Yeah, absolutely. So they need to go to the right doctor. They need to go to a doctor who's qualified. So they need to seek out somebody who's board certified.
In pain?
Absolutely.
Okay.
So these need to be pain specialists who know what they're doing. This needs to be somebody who's just not doing this out of the back of their office or in a surgery center recovery area. This is done with very, very high-tech equipment, very, very high standards.
And it doesn't cost more to go. I mean, you're covered by insurance. I mean, if they ask their primary care physician and they're in pain, I want to see a pain management specialist.
Absolutely.
They'll get to see you.
Absolutely.
Okay.
We get a lot of patients from primary care physicians, from neurosurgeons, etc. So these are patients that typically have something like sciatica, a pinched nerve, some sort of nerve irritation in their spine. This is a really, really common occurrence. It happens to 80% of us in our lives. So this is a really, really high frequency issue. What they need to do is get to see a pain specialist, hopefully sooner than later, within at least 6 weeks of the injury. And then what they'll do is get some sort of MRI evaluation of their spine. And then the goal of this is to get them back to a higher quality of life, get them back to sleeping at night, enjoying their family, enjoying work, improving overall their overall satisfaction.
So what's normally happening then? Isn't that what's currently happening? So let's just suppose they don't go to pain management specialists. What's normally happening? They're just medicated?
Oftentimes,
like with oral medications?
Oftentimes they don't get any therapy whatsoever. Patients are told to rest and deal with it for at least a month. Then they go to physical therapy or some sort of interventional therapy that could involve manipulation of the spine or something along those lines. Many patients do well with those, but those are not standalone therapies. Interventional therapies that we offer work very well with those. So those are very one-sided tools. When you then start to integrate injection therapies, getting right at the root of the problem with rehabilitation, with strengthening of the spine, with manipulation, with based upon the imaging and the MRIs, this is where patients get back to qualities of life much sooner.
Okay, so now when you do these injections, you're looking at a scope or some sort of a guide?
Absolutely. So this is all done under real-time X-ray guidance. So this is a very, very high-tech piece of machinery. This is done where there's no guesswork involved. So patients can have the satisfaction knowing that there's a pinpoint accuracy, almost precision
of where the pain
guidance
is coming from.
Exactly.
Okay.
We often use laser guidance systems as well. There's real-time X-ray. We often provide local anesthetic with some sedation, so patients, if they're anxious about the procedure, they can tolerate this, and this is over within several minutes.
So with the steroid that you inject, it reduces inflammation, so you can get people back to movement faster, and then combine it with their physical therapy, etc.
Exactly. So many patients have weakening of core muscles. That's a very common thing. We hear this all the time, strengthen your core, strengthen your core.
Okay.
Well, if we can work on that, if we can allow the patients to, number one, block the pain, and then get into some sort of rehabilitative therapy, that's going to improve their core muscles, improve their overall quality of life, improve their trunk muscles, and then hopefully prevent re-injury in the future. Most of these patients will get better over time. Most patients do not need surgery. But again, getting the proper therapy sooner than later is going to be highly advantageous.
So by the time they go to you, again, last resort kind of a situation oftentimes?
Oftentimes the horse is out of the barn and it's a later resort in the treatment algorithm, absolutely. So if they can get to someone like me sooner, as well as the integrative therapies with the physical therapists, rehabilitation, the imaging studies sooner.
I mean, isn't this what people want? I mean, people want to be out of pain. Are they afraid of these injections?
There can be some
I
misconceptions.
mean, are they telling their primary care physician, I don't want a steroid injection. I don't want steroids at all.
Exactly. So many patients are scared of these injections because they're afraid they're going to hurt, and they're scared of the potential pain from an injection. But
That's the only thing they're afraid of?
That's one of the biggest issues.
Interesting.
So
okay.
Anybody that's going to manipulate a needle near their spine causes a high degree of anxiety, which is rightfully so. But with these advancements that we use nowadays, the fluoroscopic guidance, the laser guidance systems, the X-ray guidance in general, as well as the local anesthetic therapies, and even providing a little bit of sedation, no different than a colonoscopy, this is something that can be done very, very easily.
So these steroid injections, are they shoulders or just always epidural?
Usually in the spine,
Okay.
so the neck, the back, the mid-thoracic spine as well.
Okay.
But we can also inject joints as well. But that's not technically an epidural at that point. That's a peripheral joint injection. But classic for arthritic spine pain, arthritic pain in the knees, hips, ankles, etc.
And how often do they have to get them? Like if people that want to stay off drugs.
Yeah.
How often do they?
Usually 3 times in a year is about the maximum frequency we can
And that
see
can
with this.
last?
That can last. So I usually tell my patients they can expect somewhere between 3 and 6 months of relief, which is good because we don't have any medication that can last that long. If I were to say to you, Randy, here's a pill that will last you 6 months, take it once, you would probably jump at that. But again, pills and medications don't work that way.
So it's like Botox. I mean, it has a long-lasting 3 months.
Absolutely. Absolutely. So when done right, and for the right indications, this can be a highly effective therapy.
Okay, I'm going to put you in the spot here, but in San Diego, okay, would you say there's 10, 20,000 people, 50,000, 100,000 people that are on medications right now and that are accompanied by all those side effects that could be getting a steroid injection?
Yes, absolutely.
That would wipe out their drugs without the side effects?
Certainly either decrease their use of medications or ameliorate their need for medications altogether. Absolutely.
But would you say tens of thousands?
Tens of thousands, absolutely. I perform probably 3,000 to 5,000 of these injections per
Are
year.
people ever frustrated and say, why now? Why did it take so long?
Exactly. So
I'm not trying to side with you here, but if what you're saying is accurate,
yes,
I guess it's just about the public awareness that, hey, see a pain management specialist.
You're only as good as your options. So not knowing about your options is really the biggest detriment. So somebody may not know that they can refer somebody to our office. The patient may not be forthcoming and as proactive as possible. There could be misinformation out there. There could be insurance limitations to access. So there are many, many factors that lead patients the wrong way. So we try and demystify that and try and increase access the best we can.
Okay, what are the dangers, by the way? Because there is some negative. I don't know what those, it doesn't come to mind, but there are some negatives about the steroid injections.
And this is where you need to go to the right doctor. So there are certain dangers and inherent risks to any kind of manipulation in the spine. So you need to have a doctor who's well trained. You need to have somebody who's board certified in some sort of pain management specialty. After that, the injection needs to be done in a sterile environment because of the risk of infection. This is near the spine. And then also this needs to be done under X-ray guidance, fluoroscopic guidance. So you need pinpoint accuracy.
Are there some that aren't?
In this day and age, that would be outside the standard of care. I would probably say in this fine city, that'd be incredibly rare, which is a good thing.
So the only negative things you could say about it is, people are worried about infection.
Correct.
And pain.
Pain from the procedure
and
is a big one.
Pain, do they complain about pain? It's like, oh my goodness.
Usually patients go through this procedure and they come out on the other end and say, I was worried for no reason. This was much easier than I thought it would be. I usually equate this to maybe the equivalent of maybe a dental procedure, a filling, or some sort of mild dental
So it's really
intervention.
Nothing. I mean, you're
really
a pain
nothing.
guy. Could you give them pain, some sort of a pain something to alleviate their pain for the injection?
Yeah, so sometimes we use mild sedation. Sometimes we give patients, a sedative for that matter.
Okay.
But usually that gets them through that without any kind of issue. This is also done with local anesthetic. So we numb the area, no different than a dentist would numb the teeth if you were going to do any kind of dental work.
Okay. So ask your doctor to, and just for clarification for people that are just tuning into this, how does somebody find doctors like you? So
yeah. So
what is your training?
My training, I'm an anesthesiologist, board certified in pain management.
So you're taking people out of pain while they're asleep?
No, not necessarily. So my goal is to work with awake patients.
That's what I mean. I mean, as an anesthesiologist, you're taking them out of pain while they're asleep, and now you're doing it while they're awake. That was what I was.
Exactly. So that is it. So we are now on the other side in the recovery area and dealing with awake patients in this.
So after medical school, tell me about your fellowship training.
Yeah, so I trained at UCSD, University of California, San Diego, a top pain program, one of the leaders on the West Coast. We learned our trade from the faculty there, and then I was also an attending there at UCSD, teaching fellows and residents all the things that we do on a regular basis. So it was very nice, very rewarding. Now I wanted to get involved in the community and actually serve the community and give back.
Okay, and the interventional part, because you did also an interventional fellowship.
That's correct.
And what is that?
So that's an additional 1 year of training after anesthesiology residency. So that involves taking more tests, staying longer in the hospitals, and learning the trade and the surgical skills needed to do these types of interventions on the spine safely and correctly.
Okay, good. Now, we're out of time again, but on your way over here, if there's one message you want the public to know about epidural steroid injections, what is it?
Safe, effective, rapidly acting therapy to get patients back to life, improve their quality of life, get them back to work, off of medications.
Do you have some people that swear by them?
I have many patients
Like that have
come
been out
back.
of pain for years?
I have little old ladies, moms, dads, construction workers, police officers who swear by these therapies, who come to see me a couple times a year, and they do very well. They're able to participate in the quality of life that they want. If they get off their medicines, they can avoid those types of therapies.
Yeah. And your goal, in the green room, you told me, our goal is to get people off drugs.
Correct. Despite popular belief, pain specialists want to get you off of drugs, not on drugs.
Yeah, you know, it is hard to believe. And I can see, I was trying to think, if I'm at my primary care physician, the last thing I want to do is see a pain management guy, because you think that's the guy that's going to give you drugs.
Exactly. So that's a common
Interesting.
misconception.
So with you know, stimulators and anything else new on the horizon we need to know about?
Yeah.
So getting rid of pain?
Yeah, so the latest and greatest is going to be probably regenerative therapy, so stem cells, things of that nature, where we actually work beyond inflammation, but we try and restore spine function and try and restore natural anatomy.
Okay, how long do we have to wait for that?
Well, we're involved with the FDA and some cutting-edge companies probably later on this year, but we're looking at the disc, which is kind of the final frontier, and trying to regenerate the disc, which has always been a hot topic. But
are they saying it's being done right now in trials?
It's being done right now. There's some pilot studies out of Australia. There's some pilot studies here in the U.S.
It's working?
It's working. Yeah, the preliminary data is really, really encouraging, so we're taking it to a next level in a widespread study across the country.
Okay, good. I want to thank you for coming on the show. If they want to go to your website, which we'll have your website listed, they could go there.
Yes.
They can ask their primary care physician to see you.
Absolutely.
All right. Thanks for
Great.
coming on the show.
Thank you so much.
Very interesting. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again or tell a friend about it, you just go to our website at wellnesshour.com and put in pain management. Or if you could spell Dr. Dobecki, you could put it in there. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.